Bismillahirrahmanirrahim. Assalamualaikum and a very good day. Thank you for inviting me to this webinar session to present the publication. My name is Dr. Ismail binti Awaluddin. I'm happy to present this publication from my master thesis. All the three publication came out from my master thesis entitled Determinants of Treatment Success Among Children with Tuberculosis using MyTB version 2.1 and their parent perspective on successful treatment. These are my research team member from University Technology Mara, TB sector and also University Science Malaysia. So without further delay, let me start the presentation. So this is the three titles that I mentioned earlier. The first one is Exploring Challenges Faced by Parents of Children with Tuberculosis in Klang and Petaling District of Selangor State, Malaysia, a qualitative study. The second one is Parent Experience and Perspective toward Tuberculosis Treatment Success Among Children in Malaysia, a qualitative study. And the last one is Characteristic of Pediatric Patient with Tuberculosis and Associated Determinant of Treatment Success in Malaysia using MyTB version 2.1 database over 5 years. So let me start with the introduction. TB is still a public health problem worldwide. Tuberculosis is a public health problem globally, and tuberculosis among children is referring to 0 to 14 years old. About 10 million of the people is having TB disease, and 10% of them is among children. So why TB among children is important? Because children is a vulnerable group. There are challenges in making the accurate diagnosis for the physician. High mortality rate if left untreated, and there is ongoing TB transmission in the community. So what are the determinants of TB treatment success among children? So the first one, previous literature have found that age, HIV co-infection, type of TB, gender, and place of residence. So how parents deal with children who fell sick due to TB? So previous study also observed some themes of seeking behavior, social support, dot issue, lack of knowledge, and also TB stigma. So we can explore this thoroughly using the health building model. It's a behavioral theory to understand people experience facing the life difficulty in life. So what are the problems in Malaysia? Let's focus to the figure 1. As we can see, so the first one I want to show that there is a palliative treatment success trend in Malaysia among children, and sub-analysis of the red line showing that the under 5 years old group, 0 to 4, having under WHO target for treatment success. And the second one, I want to show that the number of registered cases among children in Malaysia is around 700, and in percentage is just around 3%. It means that the detection rate is very low, in Malaysia. So previous study was conducted in countries with high TB burden such as Africa, which have also high HIV co-infection, which differ in Malaysia. So we can conclude that we can assume that children and their parents in Malaysia are not given adequate attention. Thus, we want to study this problem. So the objective of this study is to determine the determinant of treatment success among children with TB disease in Malaysia and exploring parent perspective on achieving successful treatment. It have 3 specific objectives as listed below. So we move on to the methodology. I'm sorry for this very busy slide, but I want to show that this methodology of The methodology of this study is conducted as a mixed method, sequential explanatory study design. It consisted of 2 phases. The first one is quantitative secondary data analysis, followed by phase 2, qualitative explanatory sequential. So the first one is quantitative. It's a cross-sectional study design. Target population is children with TB disease in Malaysia. So we selected study population, the registered cases in MyTB database from 2013 to 2017. After sample size calculation, the optimum size is 2,900 plus. We exclude the data, have missing data on the treatment outcome and change final diagnosis. What we measured is treatment success versus the unsuccessful group. And we predict the parameter using the sociodemography, healthcare utilization, and TB disease profile. The second phase is phenomenology study design. We choose Klang, Petaling, Kuala Langan because Selangor have the highest TB cases in Malaysia. So we target the parent of children with TB disease who were on treatment for the recent years. We purposefully sampling for parents who directly involved with the children. Total participants were estimated at 12 in achieving data saturation. We use in-depth interview, tape recorder, researcher as the tool, and probing technique. Written consent was taken. Data was transcribed verbatim, line by line coding, and finally we did the thematic analysis using R, qualitative data analysis software. So now we come to the result. The first figure 2, showing that total cases is 3,600. We exclude 80 cases. Then we have total of 3,550. The overall treatment success rate is 90.1%. So table 1 shows the socio-demographic characteristic of the children with TB disease in Malaysia, 2013-2017. We can see that a higher percentage of older age group, 10 to 14. And from the, in terms of ethnicity, Malay is the highest number, followed by Bumi Putra Sabah and non-Malaysian. The next slide is actually explaining the treatment success rate. This slide is actually showing that older age, Malaysian citizen, those children who underwent treatment in public and private facility, and also detected using the active method is having higher success rate. The next slide, another 6 parameter of BCG score, Qualitative Finding, HIV co-infection, type of TB meningitis, and directly observed therapy intensive phase. This slide is showing the determinant of TB treatment success. We have 12 parameters to determine the treatment success. However, only 9 parameters were involved in this model. So how to read this figure? The positive association is showing that the probability of treatment success is higher compared to the negative association. The probability of treatment success is lower. In this result showing that the gender and also place of residence was not associated in this study. The final finding is qualitative finding. We interviewed 15 out of the 43 mothers, and the age range was from 25 to 52. Out of 15 mothers, 80% of the children had completed TB treatment. So the main theme that we identified during the study is evidence of having contracted TB, trust in the healthcare services, motivation to take or continue treatment, multiple challenges. So as the discussion, what is already known? So the pool treatment success rate is 84.8%. 8% from one meta-analysis, and treatment success rate varies according to countries, according to the developed or developing countries, and the WHO target is 90%. We can see a few group have a higher success rate. And this study found that in Malaysia, we have plateaued trend of treatment success among children, and those who under 5 years old have under WHO target. And we can see that we have new parameter of those who receive treatment in public and private facility, active case detection and chest X-ray of no lesion or minimal lesion and presence of dot supervision have higher success rate. So for the second one, determinant of treatment success, previously the measured parameter are differed among the studies. Some studies did not continue into the adjusted multivariable analysis, and previous study only found that number of determinant is only from 3 to 7 parameter. And what this study add is we add more parameter such as chest X-ray finding, facility of the where the children going to get treatment, BCG scar, and also HIV co-infection. The last one, previously we found that parent perspective can be divided into challenges and facilitator to achieve treatment success. And however, they do not explore the parents' experience using any behavior model. And this study explore the parent experience via health belief model, and we found 4 main theme in this study. Any study have some limitation and strength. The strength for quantitative data is a collaborative work, save the cost and robust model. However, some few of us standard definitions such as household income, household dependent, and still we can say that a limited parameter to predict outcome because we don't have nutritional status of the child, high missing data for household income and household dependent, and lack of causal relationship due to cross-sectional design. And for qualitative, the strength is phenomenal design, in-depth explanatory, and it is a primary data collection. However, this study have poor response rate and only among Malay and only among mothers. As a conclusion, my TB database version 2.1 is relevant in the National TB Control Program. Number 2, TB treatment success is positively associated with children who were Malaysian citizens in the mild and early phase of TB disease. And the last one, parents' perspective. We need to have trust toward the healthcare system, encourage support and education to the affected family, and manage the challenges. The recommendation from this study, the first one is to maximize the MyTB database version 2.1 usage and inform the relevant stakeholder. Second one is to find the case early, start prompt treatment and ensure TB treatment success, especially among those children under age 0 to 4 years. And the third one is to educate parents, community, and train the healthcare worker. I want to acknowledge all the relevant parties who are involved in this study, from the DG, the Director of Disease Control Division, and the participant. These are my references. With that, I end my presentation. Thank you for your kind attention.